Welcome to Aging While Black Live. We are so excited that you are joining us, that you're taking time to tune in to a series of what we hope and believe are very important conversations. We always like to set the stage by reminding you that Aging While Black is a multifaceted platform that elevates the voices of Black elders by amplifying their stories, perspectives, and realities. We generate collective learning and collective action around the systemic inequities faced by aging Black people and co-create policy and people-driven responses to improve today and tomorrow. I'm extremely excited for today's conversation and would love to welcome Dr. Lauren Powell to AWB Live. Welcome, Dr. Powell.
Thanks so much for having me.
I'm glad that you are here. And over the last few days, as we have promoted and shared about this conversation, we've offered people bits and pieces about you and your work. But how would you introduce yourself to this community?
Well, thank you. So I would say, I'm a board certified family medicine physician. So I'm seeing patients. My youngest is I started about 16. And then, of course, I'm seeing patients across all spectrums of life and, into their advanced age. I have a passion for food in particular, in terms of using food, which I believe is a very powerful drug, to improve health, manage disease. So it's always a conversation that I have with my patients, no matter what condition that we're talking about. It's a conversation that I take beyond the doctor's office and, in various capacities, whether courses, I know we talked about that briefly before starting this call, media, social media stuff, articles, and just trying to get the message about how do we improve our health with food. And then, even beyond that, but what are the other things that go in to promote us, not just living long, but living long, disease-free and with a quality of life.
So it was interesting to note, I could not help but note your description of food as a powerful drug.
Yeah. I mean, it definitely has the power to do good things, right? I mean, it has the power to do good things, but we know that certain foods also have the power to cause harm. I was just reading an article this morning about, I forget the specific ingredient, but certain foods are now banned in California, foods that we consume regularly, foods that are banned in other countries, but are very readily, promoted in the American, population, the American country, because we know they cause harm. We know they are linked to cancer. And so we know that food, we have seen it again and again and again, has this power to cause harm or to cause good. And so I consider that a drug.
Yeah, it is. So what does the concept aging while Black bring to mind for you?
I was thinking about that. And like you kind of said earlier, Black folks, we have a unique experience across all facets of our life. When it comes to children, they have a unique experience. I have a young baby, a toddler, and I think about the unique experiences that he has and in, his learning environment. And so those uniquenesses that we need, extend across all aspects of life. And I think in terms of medicine, I think it's why more and more patients are seeking providers who look like them. Not just because, we all have medical knowledge, but we, as someone who also shares this unique experience, we can kind of see their health through this multicultural lens that you just may not see it if you're not Black. And so I think just, again, that empowering people to get with the provider that makes you feel good and feel encouraged and feel positive about your health. So just in the health perspective, that's kind of what I think about when aging while Black.
Thank you. So as I was looking at the absolutely marvelous website that you have that talks about your work and invites people into the space with great ease, I might add. I could not help but notice that there was a pivotal life moment that brought you to your current work. Can you describe that moment for us?
Sure. I think that's referencing my time when I was in residency and getting off of a 36-hour call. My dad was someone that I used to talk to while I drove home to kind of stay awake while I was driving. And having this time where I was talking to him and noticing that he wasn't acting like himself. Speech is very, slow to respond, hard to understand, and recognizing that my father was having a stroke on the phone. And it was a time that really challenged a lot of my views in medicine because my father was not a neglectful patient. He was someone that was going to the doctors every 3 months. He was someone that was taking pills in the morning. He was taking pills in the evening. And so I really recognized that you can take a bunch of medicine, but if you're not changing what you've put in your body, again, which is a drug, if you're not changing that, you're not changing how you move your body, if you're not changing your stress, bad things can happen. And so that's when I kind of pivoted because I recognized in order to really help my patients and serve them in a way that they deserve and that deserve, that do justice, that thoroughness, that I was going to have conversations that I wasn't trained for as a medical student and as a young doctor. So did some additional training in culinary medicine, really so that I could just better have the tools to educate and help my patients.
So two things, Dr. Lauren. First of all, I want to affirm for you that the comments that you made about your father's situation and the reality of taking pills, but that if you did not pay attention to what you were putting into your body, if you were not paying attention to the movement with your body, and if you were not giving attention to the stressors that were related to you, that resonated with me in a very real way, and I believe and hope that it will resonate with some others who will listen to this medicine. I mean, to this interview. You also mentioned the term culinary medicine, and obviously a conversation has in large part talked about the importance of food and how it impacts our health. But this term culinary medicine, how would you describe that? What is that and why is it so important?
So, I mean, it's really doing exactly that. It's learning how food and how we prepare food affects our health. Unfortunately, in medical school, we get about 6 weeks of nutrition, which just isn't enough time to have all the tools we need to educate patients with diabetes, with autoimmune conditions, with cancers, with respiratory problems. Like, it's just not enough time to be able to uh, take the intricacies of those diseases and kind of talk about it with regards to nutrition. And so culinary medicine was this program that I did that really kind of went deep of recognizing, in someone with a medical background who understands the pathophysiology of disease, you know, how do we match that with food and what people are putting in their body? So that's kind of what that program through Tulane School of Medicine empowered me to do.
What concerns you most about Black aging and nutrition? And in the same vein, what gives you hope?
I'm concerned, we're seeing so many generational patterns of disease, right? We're seeing my mama has hypertension, my cousin has hypertension, everybody has diabetes, lots of people are obese. So I'm seeing these generational patterns of disease, and it's really related to this generational pattern of eating. Everybody's eating the same food, they're cooking the same way, they're putting the same things in their body, they're all equally not moving their body. So that's my biggest concern. And so as a result of this generational pattern of eating, now starting even earlier and earlier, like people are just eating poorly even earlier in their life. And then combined with all these environmental factors that our kids and people are exposed to. I'm just saying chronic disease earlier. The diseases we would call diseases of old folk. I'm seeing in my 30-year-olds, and so that's a problem now because you're talking about someone who's not being exposed to something like heart disease for the last 20 years of your life, but now you're talking about somebody, having that onset of disease very earlier in life. So I worry about just like the just harmful effects of this chronic disease for such a long period of time. I think in that same breath, what brings me hope is that people really want something different. While they may have a diagnosis of, whatever disease and, certain things may have been normalized in their family, I think people are like, I don't want to do that though. Like, I don't want to be on a bunch of medication. I don't want to, like, they're just open to other ways to improve their health. And so while I, say to patients, we may need to be on some medication because, if your blood pressure is 200 over 100, you eating a kale salad today, it's not going to fix your blood pressure today. These lifestyle things are a long game type thing, but if you work with me and you trust me, we can try to see what we can do. But I think people are just more open, and that gives me hope. They're open to other things to help manage their health. I think people are frustrated with the health system. So anything that they can try to do on their own and empower themselves, I think is something that makes me excited.
Again, I just want to name in the midst of the very important things that you share, this whole notion of generational patterns, and the reality, the impact, the consequence of these generational patterns, and also the connection between the health issues and the eating patterns that are often shared down, but the connection never really made. And in light of that, as we share often, the first pillar, we have these three pillars, and we'll mention them before we leave. The first pillar of Aging While Black is about recalibrating the village. And in that pillar, we highlight the need for a comprehensive and strategic redesign of the systems, organizations, institution, and approaches, I'd add, that support Black life and Black aging. What do you think that might look like when it comes to food, nutrition, and wellness?
So I would say this to kind of start with. I find that often my patients, my Black patients, are not always prepared for a deterioration in their health. They're not prepared for it. So then what happens is they're not prepared for a deterioration in their health. So now it becomes almost an emergency of, can no longer live independently, need some kind of assistance. So the focus then very much shifts to shelter, transportation. How can we make sure medically, you're kind of getting what you need? And so as a consequence, things like their nutrition kind of goes by the wayside because we have fires, we have fires going. So, I want to just kind of preface with that. Like I had a patient the other day, 60 years old, very, functional, working, doing all these things, taking care of her grandchildren, has a very weird situation where she ended up having a stroke that affected her spine. Now she's in a wheelchair. Talking about being in a wheelchair, that's going to significantly affect your functionality and quality of life. Daughter, who's a doctor, doesn't have the capacity to take care of her because she's a full-time ER physician. And so now we're working into how do we find somewhere for you to live. And so our focus is just, I find that oftentimes if we're not preparing and being preventative with our health, when these health scares happen and these big events happen, some of these other things that seem less important, even though they're very important, kind of get put down the wayside. So in talking about recalibrating the village, I think it's important that we have these conversations with our family members early. I talk about it with my parents. I talk about it with my husband. What are we going to do, or how are we preparing for if anything were to happen to us, so that we have the care that we need so that we can still thrive, so that we're not being kind of this burden at all to our family. I think we do best in community. I mean, the studies have showed our health is better in community. So I think if we can create an optimal situation that as things change with our health, we can get the support that we need in our home so we can continue to have those community relationships. I had a patient who was so connected to her church, brought her so much joy, but physically she just couldn't live on her own. And so she had to move across states to live with her son, and her health dramatically deteriorated. And it's because she lost that community connection. I believe a lot of it had to do with. So how can we continue to live in an environment that's thriving and in a community that supports us, while also being mindful that things may happen to us as we get older? And how can we prepare for those things?
Yeah, thank you so very much for that perspective. Once again, it connected one of the most robust conversations that we see happening or attempting to happen across this country, that we are attempting to elevate, is this whole notion of advanced care planning.
Yes.
We see and hear of so many instances where Black elders and their families are placed in really difficult and in sometimes compromising situations.
Yeah.
Because there has not been any advanced care planning.
Yeah.
The other element of it is we see the inhibiting, if not the inhibiting of wealth transfer, because there has not been this planning. And you have, homes, which are households, are still the most significant transfer of wealth. We see homes and life insurance that have not been adequately addressed in plans. And so you have this challenged, if not limited, transfer of wealth in families because of this lack of planning. So when we think about this whole health through supported by nutrition, eating, overall focus on wellness, who are the stakeholders in this space, and what should we be doing to mobilize them? And do you see things that are related to policy, Dr. Lauren, and or more focused on people?
That's, when we talk about, policy and it's very difficult. It's very difficult. The number one factor of health, the number one determinant of your health is, do you know what that one thing is?
Tell me.
The number one determinant of your health is your zip code. Now, if we think about all the things that are affected by our zip code, your zip code will likely determine if it's a safe environment. So if I'm encouraging a patient to go outside and walk and spend some time outdoors, but if they live in a zip code where it's not safe, it's going to affect their health. If you live in a zip code, I went to school in Detroit for medical school, and we had no grocery stores in the town. So in order to get groceries, my parents would bring me groceries from the suburbs. So your zip code is also going to determine what food access you have. Your zip code is going to determine what hospital systems you have access to. A major medical hospital closed very abruptly here in Atlanta. It was just like on the news, and then it was like within days it was closed. A complete, huge underserved population no longer having access to a major medical institution. So now it's having to go far away to kind of seek care. So many things that are determined by our zip code. I would say we need to go after policy that affects those things, right? We need to go after policy that affects, our local resources and things that we have access to, because that's going to determine so much of our health. me as a physician, I'm always trying to empower my patients. I don't want them being dependent on me. I don't want them being dependent on their health, on this healthcare system. So whatever I can do to empower them so that they can really champion and lead their health journey is something that's super important to me. So, I had a meeting today with a patient, and she was talking about how I was like, I haven't seen you in over a year. Where have you been? And she was like, I picked some weird Medicare plan. My deductible is $10,000. Like I just haven't been able to afford to be able to get here. She said as a result, she learned that one of the local colleges is hosting a seminar on Medicare services. Medicare can be confusing, and unless you understand and know the intricacies so that you can pick a plan so that you can get the services that you're paying for, so things like that. Empower yourself. How can we make sure that you get the resources and the things that you need? I let my patients know who have a lot of health things going on. You may do better with a concierge or a cash-based service. This is going to take planning, though. This is something that we can think about as we age. Is that something that would be more beneficial to me so that I'm not limited by my health insurance of what type of doctors I can see, how often I can see them, what meds I take? And, do we need to be thinking about, medicine 2.0, or doing things that are not dictated by these health insurance companies, which are run by paid people who've never seen a patient. They've never seen a patient or taken care of anyone, but yet they're telling us what we can and can't do for patients, and they're telling patients what they can and cannot access. So I think educating patients as early as you can, invest in your own personal health, whether that's, personal trainers, health coaches, that stuff is important, because the worst thing that can happen as we age is we lose mobility, we lose flexibility, and then we could fall, we can hurt ourselves. So doing these things where we can really, when I say take control of your health, that's something we can do. You can work on how you move your body, you can work on how you manage your stress, you can work on your stress, you can work on your sleep. So I think empowering patients is something personally I want to challenge everybody to do. And then, in terms of policy, really looking at what resources are available in the place that I'm living, in the place that I'm settled, and how can I make those better?
Thank you. Just ripe with so much important and helpful information. And what I heard were equal parts policy and advocacy and other efforts, but also a significant dose of personal ownership of well-being overall. So finally, we always end these conversations by reminding folks that there are three pillars that frame how we approach this movement building around Black aging. The three pillars. The first, we talked about this recalibrating the village, that the institutions, structures, and even the approaches around Black aging are insufficient for the huge upturn that's already begun to happen in terms of the numbers of Black elders. The second is embracing innovation and rapid change. How do we use the advances that are taking place in technology to support and enhance the well-being of Black elders? And then our third pillar is leaning into Sankofa. How do we make the wisdom of the elders systemically available in ways that contribute to the well-being of our families, our communities, our institutions, and our structures? What would be your best hope as a physician, as someone who is passionately interested in the connection between the culinary and the medicinal, as a Black woman, as a wife, as a mom, as a daughter? What would be your best hope for all of this, Dr. Lloyd?
I think maybe twofold. I think we need to be more open about sharing our experiences. We need to be more open about sharing health challenges that we had. have or have had. I feel so often when I see patients, they have no idea about their family history. They'll say, oh, Uncle so-and-so had cancer, but nobody talked about that. And so also, that affects future generations, because if I know that your uncle had this cancer at this age, that would affect what I do for you. But because we don't have these conversations openly about our health, because we're trying to protect people from things, or we're trying to just kind of keep things private and we don't want to talk about that, it's affecting future generations. So I hope that we can get to the place where we're just openly more talking about our health in our family. And I really hope that we truly embrace this concept of community. Like, we are meant to live and thrive together. We are not meant to have I was listening to this podcast that's about this community where they're really bridging the elderly with the children, because often these two groups are completely separated. But that's not how it was meant to be. I think if we look back in history, we were all together and we were living and we were thriving together and we were learning from each other and we depended on each other. So I think getting back to this way of being where we can just be more connected and a part of each other's lives, that would be a huge that would be something I would love to see. I think food wise, I think there's a way. Food is more than just sustenance, right? Food nourishes us. It can nourish us emotionally. It can nourish us spiritually. It can nourish us, connection wise. I just think we have to redefine or rethink about really how we pick the foods that we put in our body. So I think collectively, if we can think about how are these foods that we're eating serving my body, and if they're not serving it in a great way, how can we honor traditions of our families, and our communities, but still nourish ourselves well? So I think that's another hope that I have for community. I think that's it. It was another thought I had, but now it's escaping me. But I really, I think the financial piece, as you've talked about, that was the last thing, is really, we don't like to talk about death or being sick, because I think we feel like if we talk about it, it's gonna come. But I can tell you 100% chance death is gonna come. It's 100% chance, right? So so I think just having conversations, and I talk about this with my parents a lot. I've talked about it for years. Okay, listen, do you have this and this together? Do you have this together? What would you want to happen? How do you want to be cared for? I know you love being in your house. If you want to be in your house, and I don't live in your state, we're going to make sure you have to have care. That's going to cost, that costs resources. And I say this to my husband too, and he thinks I'm crazy talking about it in our 30s. But what I tell him is, we don't want to be a burden to our son. It's not his responsibility to take care of his parents while he's trying to thrive in his adulthood and have a family for himself. I don't want to put that burden on him. If he's in a fortunate situation where he can, that's great. But I'm not going to go in with that's my plan. Is my kid's going to take care of me? No, what can I do right now to take that burden off of my family so that he can continue to advance and do well without having to know that for 10 years of his life, he had a huge financial setback because he had to take care of his ailing parents. So I think having that conversation and making financial, whatever little things we can do now, it's just going to make a difference later.
Thank you very much, Dr. Lauren Powell. It's been a joy to spend this time with you, and thank you for making it available. If people want to learn more about you and your work, where should they go?
Oh, I'm always on Instagram at Dr. Lauren Powell. I'm on Facebook at Dr. Lauren Powell. I'm on LinkedIn at Dr. Lauren Powell. My website's doing a little bit of updates, but normally you can find me on my website at drlaurenpowell.com. You can always email me at info@drlaurenpowell.com as well.
Thank you, Dr. Lauren Powell. It's been a joy to speak with you. I wish you the best and look forward to connecting with you again in the future.
Yes, thanks so much for having me.
And thank you for joining us for AWB Live. We'll look forward to seeing you next month, same time. And thank you for joining us.
Thank you.